now. Welcome back. 51 minutes past the hour of 12 o'clock. We're still there here for Health Corner. Dr. Ose still there here live with us. And like us, you go fit join the conversation on Facebook, on YouTube, Wazobia FM. And now Wetin you go fit type in Oga Madam Show with Cheche. And then you go find Wetin they happen. Facebook people are the hell now. Some of them are there, they argue about my name. The name not Cheche Smith. And you go fit begin to send your questions on WhatsApp. Doctor, welcome back on top of the show.
Okay, thank you very much.
So you stop somewhere.
I will just tell them the main part. Now we're at how do we prepare a woman when we have established a reason for the cesarean section? Things like some women also have failed induction of labor when they have induction of labor or failed instrumental delivery. And it's possible for a woman to be fully dilated. I'm sure women hearing know the meaning of fully dilated when she's about 10 cm itself. And they still go for cesarean section. So a lot of people may ask that because what they call maybe borderline pelvis or a contracted pelvis, baby can't come out.
Okay.
So now how do you prepare a woman? Not just pick a woman and say, okay, let's go. And that's why there's the preparation. That's why we now say, what are the types? You can have an elective cesarean section where you plan it. This is the indication and to give you a woman a set date. Or you can have an emergency cesarean section where the mother has to be in the theater within a very short duration of time. You can have scheduled or urgent. Now, for the cesarean section, you do a workup for the woman, do blood tests, do urine tests, do some other scans, do what they call CTG, to know the status of the baby and welfare of the mother. Because if the mother is not well prepared itself, they could have complications during cesarean section, which we will get to as I'm talking.
Right.
Now, you can give what they call prophylactic antibiotics before cesarean section. You can do skin tests to know whether this woman is going to react to these said medications. However, some of these steps I'm saying, some of them is not sacrosanct, but in ideal settings where everything is working, you should do that. Now, when a woman is moved into the theater, we don't just take knife and bring baby out. Now we have to give anesthesia, and that's why some people during the counseling and during when you are taking consent from the woman, you must take consent from the woman or husband or both of them. You have to tell them, discuss with them the type of anesthesia that would be appropriate for them. Anesthesia to make her not feel pain or the spinal anesthesia or epidural.
Okay, doctor, I'm glad you mentioned that part. Sorry, before I forget, there have been conversations on that anesthesia and how did they give them to these women, and the one way go make them sleep off, and the one way go keep them awake just to monitor their BP. Yeah, right. I want to make you pay more attention on that.
Yeah, right. Now, for more than studies have shown that more than 78 to maybe 84% of cesarean section, most times spinal, and the other parts, or it could be general anesthesia.
Okay.
Now, when a woman, the choice of anesthesia depends on the anesthetist, that person that would
administer it. Okay.
The obstetrician, and then the woman. Now, it depends on the most appropriate ones. Now, when a woman says, "Oh, I want to be awake during cesarean section," yes, we can give her either a spinal or an epidural anesthesia. That one we go to her back. I'm sure that many women who have done surgery know what I'm talking about. They tell you to lean forward, and they look for they measure some parts and they inject some drugs that will deaden your body to pain or any cut or anything, and still keeping you awake. You can discuss a lot of obstetrician when we are doing cesarean section. You're discussing with the mother, how are you doing? She said, "Oh, I'm feeling nauseous," and so you can discuss with the woman. But that has the drawback. Sometimes the women are too, we like all the garrulous now, or the cautious. They talk too much, and sometimes you just want them to be quiet. And when you have women who have very low threshold to maybe pressure, because sometimes you feel pressure during this thing itself, you prefer them quiet. Now, general anesthesia is given, the woman is asleep. Maybe most times give their indications for it. But chief of me, sometimes when woman is obese, sometimes when the indication and you need, because this one, general anesthesia is quicker is quicker to for anesthetists who are good and who know how to bathe properly. It's quicker. In minutes, you can start your cesarean section, drape, and start your cesarean section. Now, there's the regional general anesthesia itself. There's prolonged. Sometimes they say for general anesthesia before before your bowel movements come back after the cesarean section, it takes longer, maybe more hospital stay, maybe anesthetic complications, pains, etc. So they have their own various advantages and disadvantages. So they should know, people listening to general anesthesia, when they say general anesthesia, you'll be asleep. When you say spinal anesthesia, you'll be awake and discuss. Now, during the surgery, we make an incision. Incision depends on, first of all, the type of surgery you're about to do, the history of the woman. For example, the most common type is the lower incision. I'm sure a lot of women, especially for cosmetic reasons and for it's based on the obstetrics and gynecology guidelines, called the Fanning steel incision. They do a lower cut into the abdomen. Then when you develop into the peritoneum and get to the womb, the type of incision there also matters. The type of incision on the womb could be either a lower uterine segment incision or a smile incision, or you have an upper. When you have an upper longitudinal incision, it's called classical. A lot of women know this. Why do they know this? Because they are being, especially those who have had cesarean section. They'll tell them, like, if you have the classical incision, that's the longitudinal one, you must have a cesarean section for your next baby. It's because of where the type of fibers that are on the upper part of the womb itself. Whereas when you have the lower smile incision, you can actually achieve a vaginal birth after cesarean section, which we'll get to now. Now, after we make the incision, we deliver the baby. When you deliver the baby, depends on the presentation of the head, the buttocks, anywhere. Then you call the cord, clamp cut, and give the baby to the pediatrician. Now, before this section, everything must be prepared. The anesthetist, the pediatrician, the nurse, the anesthetic nurse, the anesthetic must be on ground. Blood transfusion, you do your blood, is she O negative, these are things you must know because it determines your post-op care. Now, when the baby comes out itself, you now begin to suture back. You have there are different layers. I don't want to go too deep into medical this thing, but they know one layer. These are things you decide when you're abroad. You can discuss with your doctor in Nigeria. Ahead of this, are you going to do a 2-layer, this thing for my womb itself? Sometimes they do a 2-layer or a 1-layer suture of the womb. They cover the covering of the internal organs, and they cover the muscle covering. That's called the rectus sheath, and sometimes the muscle, and finally the skin.
All right, hold on. Give me 1 minute. Give me 1 minute. Finally, the skin. Now, where you stop? Give me that 1 minute. I come back to you now, doctor. And Lagos will still there here for you. I hope you join the conversation on different platform. You don't need to touch your diet. Just 1 minute. Now, waiting we need for this time check, and then we will come back to you now. Sharp. Begin to drop your question, because after this phase, now the question will they go to straight. Okay? Will they come back now? Welcome back. I was still there here for you. Still the talk about cesarean section. Time for you to send your messages on Facebook. Please find us Wazobia FM. We get so many people that listen on YouTube. Also join us live. Send your question there. Go on top WhatsApp now. Drop your question 070-959-75808. And I go try open the phone line 0700-951-951-951. And Dr. Ose will begin answer your question. But you need to move on to fit get to that particular point when we go begin to answer your question. Doctor said welcome back. So here we go.
Yeah, thank you. Okay, quickly. Now at the skin level, we're at the skin level for the Cesarean section. Now it's good to be based on cosmetic reasons itself. There's the way you make incisions, lower incisions, and you follow that dermatome. It's called dermatome itself. You follow the lines, the Zand. They call them the Zand lines. So that when you finish suturing, most times a good suture, especially for primary CS, primary cesarean section is a woman who has undergone her first cesarean section. So you should give her a good, clean one. And you must also ask, are you a keloid former? Because those things also guide. Because keloid formers after cesarean section, they have keloid formation. Keloids. I don't know whether you've heard of keloid. I'm talking about I've seen some people, their earlobes, their chest, you see some things like a thick muscle. Those are called keloids.
Okay.
Some of them have it on the nose, midline, some have it up to even at their clitoral part for itself.
So you mean the doctor need to ask the woman whether she understand what it mean?
Yes, you discuss. That's why you must counsel the woman before. It's the most important part before you do a cesarean section.
All right.
Now, after cesarean section, you don't just abandon the woman in the ward or abandon the woman. Now, there are possible complications.
Okay.
Possible complications that you must tell a woman after. That's when you now have arguments of vaginal delivery versus cesarean section. However, before we get that, we're on cesarean section. Now, possible complications could be early complications, late complications. Early complications could be anemia, maybe blood loss itself, possible infection.
Okay.
Post wound site infection, maybe the for itself going together, there might be too much blood loss, and the woman has we now need to do what they call a hysterectomy. In some cases, maybe in cases of a woman who has had maybe 1 or 2 previous cesarean section, and the placenta, I'm sure women listening all know what placenta is. Mm-hmm. The placenta sometimes adheres to the womb. It becomes too adherent and it cannot be removed. And if the placenta can't be removed, the woman can bleed to death. So sometimes you may remove the whole womb, and it's a life-saving procedure. And she will take another consent. Whether her takes a consent itself, or depends on the laws of the land. Maybe her spouse can take a consent itself. Most times when she's under spinal, these things are explained to her. Other long-term complications could be adhesions. Adhesions are band-like forms of fibrous tissue that forms after cesarean section. That's why before you as you're doing cesarean section, you can also tell your doctor, hope you are going to take measures. You can ask your doctor, hope you are going to take measures to prevent adhesions, like adhesion barriers, minimal handling of tissue inside. Don't use there are some special types of gloves that are tap-free, no powder, this thing. You should control the whole bleeding as they are going in. Those are things they can do to prevent adhesions and bleeding.
All right.
Now, post-op blues, postnatal depression, those are things that could occur after cesarean section. Longer stay in the hospital, longer, a lot of women say, those who want to keep their bikini bodies and stuff say, they can't expose, and so those are social complications and other possible complications.
All right, so we talk about the myths around it now.
The myths, that's what I'm going to now.
All right, yeah.
Now, the myths surrounding cesarean section. Now, cesarean section is not sacrosanct. That's why they have what they call vaginal birth after cesarean section. You can actually attend vaginal birth after cesarean if you meet some criteria. Now, the myths around cesarean section, especially in Nigeria and Africa as a whole, I've had a lot of experience. Your wife, she has been in labor, she has had prolonged labor, and we might need to section her because of the presentation of the baby. I'm giving a scenario now.
Okay.
And you hear things from the relations of the family. God forbid, it's not our portion. It's not this one. It's not this.
Yes.
It's still. You'll be surprised to know the kind. Even some elites still have some, what I call the aberrations to cesarean section. Now, cesarean section is actually shorter. Sometimes it's just shorter. 45 minutes, baby is out, except there's any complication. 45 minutes, class, everything is they are done with the whole stuff. But now what are the causes of these myths? First of all, religious factor.
Okay.
We some in Nigeria, I took Spain to get to some churches and some pastors and stuff because they sometimes could. I won't say they all cause they all cause trouble because in my church in Nigeria or this thing, if you're having any complication, you must go to the hospital for itself. You have a case that a woman is in labor for 2 days and in a church hospital, and it's when everything is going, the woman has labor. Sometimes we lose the women. You tell them, oh, we have to do cesarean section itself. They said no, that they must deliver like the Hebrew women. Now I must tackle Hebrew women here now. Now Hebrew women are women from where? Israel.
Yeah.
And you from Nigeria, you are a Nigerian woman.
Okay.
And based on your beliefs, yes, you now feel okay, Hebrew. Now, those women, their pelvis is the way it's structured. Pelvis is where the baby, the womb, everything stays.
All right.
The way it's structured itself, it gives an ease for normal delivery. Now, African pelvis, the African woman, because of the shape and everything, the concavity itself and convexity, that's why a typical African woman, because of that advantage, it curves it back. And the shape of the pelvis sometimes could result in a difficult delivery. So, cesarean section still puts and still God-given advantage for
doctor. So you dey shake this table now, and
we
have to shake the table, because I like how you mentioned about pastors and some religious leaders wey go tell their people say no be their portion, and it don't lead to death of both babies and mothers, and life goes on. Nobody they channel energy to fight this kind of belief system wey no dey work. Now tell me, you don't encounter you dey now wetin you dey go through all the time? You get women coming to you for all these issues, but what do you do now in a situation where the woman is in pain and dying, and then you get a husband or a family saying it's not our portion, but not be them they're pregnant, or now the woman they're pregnant and dying, and they consistently they talk no portion, the woman must deliver. What do you do in that case?
Yeah, and in tackling these men, I always go, first of all, the first thing that you have primary prevention, secondary prevention. Now, primary prevention itself is education of the general populace about this whole stuff. Now, let's talk the action of going to maybe when they are giving a testimony that the doctor said she will do a cesarean section, and by the grace of God, the doctor was defeated. God, these are education.
Is it not also the grace of God for you to do CS?
Yeah, and also education of these who feel that when they say, oh, how did you give a cesarean section? They feel they are drawn back as if you committed a crime. No,
we need to go and break. We need to go and break. We'll go take that what you do when we come back. So let's come back to you. Yes, welcome back. We're still there here for you. Still they take up the time on Health Corner. Still with Dr. Ose for you already. Out for you to answer these questions. But first, you be one finish up.
Okay, yeah. Now, what I do when I face that scenario where so I call the most important. So usually the people who actually are rejecting and praying and I will call them the non-important people who matter in the scheme of things. So I gather the people who form the vanguard of this crusade, the man, the husband, and maybe one sister, just maybe two family members. So you have relatives who are praying outside the hospital.
Wow.
So this is the device of the doctors. Let the doctors. Are we not devils? So what I tell them, I'm firm, and I try to be diplomatic. Why do I try to be diplomatic? Because it's consent of the woman and or the couple. Because you can't do a cesarean section without the consent of somebody.
Yes.
Even if you sometimes if you say the day and you don't get the consent, you could be the litigation could be filed against you. So what I do is that I try to be diplomatic most times, and you try to be fair. You give them the scenario, and you tell them, especially it depends on the religion of the person. So
yeah.
Do you want to because of this man, not the sickness? That's why maternal mortality is very good. Should be reducing in Nigeria. So the religious bodies have a lot to play. So I tell them, and I try to counsel that this is worse, and most times it works. I go as far as sending everybody out of the ward, sending them out of even the hospital, close by itself, and letting the decision, because most times the man most times wants to let his baby come out, but the pressure from other places itself, and most work. But if it doesn't work, like 1% to somebody, the man can shoot the hospital. So they sign and I form my consultant, everybody who is involved, the legal team, the medical ethics itself, and they are aware of the situation itself. So at that point, you are not held liable.
Wow. All right. So we get loads of questions for you, and I've been telling you before. Say please send your in so that Dr. Gofi run them over. I get this one. She said, "Welcome on the food page to ask Dr. Ose. I've had cesarean section 3 times, and I would like to have another baby, but I'm scared because the hospital I'm using, they usually give me sleeping injection. So I'm planning to change to another hospital. And is it advisable for me to have another baby?"
Okay, so
3 times.
3 cesarean sections.
Yes.
Yeah, there's a limit. There's a limit for cesarean sections based on where you are and based on practice and based on the availability of many factors and many facilities. Okay. Some consultants and some authorities, they take 3, they take 4 cesarean sections as maximum. But in some places, like me personally, I've seen 6 previous cesarean sections. Here where I practice, I saw, was it 6 or 7? And I was like, What? 6 or 7? Why? That's the reason. So that's why if you have 3 previous cesarean, what happens? When you're pregnant and your first cesarean, your second cesarean section, I mentioned starts to build up, especially things like adhesions and stuff. Now your third for that, you are going through the womb. You are going through the womb and the placenta is in different segments every time. No, so there's high risk when the morbidly apparent high risk of having things like placenta previa, what's heavy, the placenta goes to lie lower, and some other health complications. So, when your woman is having a 3rd cesarean section, you should have a good obstetrician should advise on family planning. So, for her, if she's already pregnant, fine. She should, yes, of course, she will definitely have a cesarean section. Doesn't mean that anything is happening. She's going to sign a high consent itself. And her's afraid that they'll give her sleeping this thing. It depends on many factors that I mentioned.
All right.
Is this necessary? Do they need to curtail this? How are they going to do the guards? It's safe.
All right.
But I think after she should get on a permanent family planning.
All right, permanent one. Yeah. All right, that's a matter for another day. Now, somebody asked question, say, my first cesarean section was caused because of BP, and now I'm scared to get pregnant again. This topic is for me. What do I do, doctor?
Yeah, a previous history of pregnancy-induced hypertension, or what they call preeclampsia, or eclampsia, as the case may be, there's a higher possibility of you having it in your next pregnancy itself. So now, what we do for these women, especially for if she has other risk factors, it depends on how we grade that, whether she's a high risk pregnancy or a bad obstetric issue. What we do is that of course, we have to get it early. Now, after 20 weeks of 8 weeks before you can define a pregnancy, hypertension in pregnancy, we place her on medications. A woman with pregnancy, hypertension in pregnancy is not an absolute indication for cesarean section. Of course, there are many women who have normal delivery, who have instrumental delivery, forced delivery or pregnancy. So what I advise for her is that if you have one child, it depends on your family cycle. You can get pregnant. You can be placed on BP lowering drugs, safe one, I don't want to mention it, but safe medications during pregnancy, and you can deliver. But if need be, where the hypertension, because there are many factors that causes it, you have vascular theory, intestinal theory, remote theory, and many other theories. If needs be that we can curtail it, maybe at 10 or before 10, very good. Another cesarean section is indicated, and it's safe. It's safe. Depends on where and how. If you're not comfortable with your center, you go to a woman must be comfortable in the hospital she's having her cesarean section.
All right,
It's not.
It's not what?
It's not circumstance that you must do it in just one hospital. If you're not comfortable, go to where you are comfortable with. Yeah, so advance that there's no problem.
All right, doctor, I try to rush up these questions because we get loads of them. And somebody say, okay, so I went to the hospital and they told me that I have a problem with my cervix. And then I went back to tell my pastor. My pastor said we should be praying. And but my mind is telling me that if I should follow that, I might have a problem. I think it's the same God that still allow doctors and give them the help to do the CS. Cheche, I think I need to leave my church. Listening to you now, it feels like this topic is for me. Please ask doctor for advice for me.
She has said it all. Now they said you have a problem with your cervix. Cervix is one of the very important parts of the womb that actually controls labor and even have the teen pregnancy. If she's not pregnant and she has been having recurrent miscarriages, it could be what they call cervical incompetence. Now, it's the same God that gave the doctors the intelligence to know this itself. It's the same God that allows for vaginal delivery. So sometimes she might need what they call circlage insertion. If her cervix is too short, I don't know what's the problem, because many things could be with the cervix. Maybe she has a too short cervix, or maybe she has cervix that is just dilated. She might need some procedures to keep that cervix closed. And many a times she might need a cesarean section if need be, if baby gets to 10 removal of the cervix and doing a cesarean section. So it depends on what the problem is with the cervix. So she should seek good gynecological advice.
All right.
It's not a pastor, even a pastor who is a doctor. A pastor who is a doctor should also know. Pastors know, because there are a lot of pastors who are doctors, should actually make this a routine to always educate their congregations.
All right, doctor, we'll come back to you and then we'll go run some of the questions fast. I'm so sorry. Thank you. Say you take out your time to come here. I know. Say after now you they jump on top. You get any woman where they deliver today?
No, I'm on 90. I'm at home. I'm at home today. Luckily for me.
All right, thank you. So Lagos, so they come back to you, send those questions. Dr. Ose still there here to answer questions. But we'll still get information minister in the building and she go drop them once we come back. Lagos, we day here for you. Yeah. You know we got you. And plenty of now they tell thank you for this topic. Thank you too for listening. Will they come back? No touch your dial. roughly 12 minutes to fill wrap up. And we're gonna need to take more of your messages with people that send to you. Okay, now I could do 3 phone calls and then maybe 6 or 7 messages. But first, the message. Somebody say a great topic today. I've been paying attention and writing down. I've had problems with my husband concerning CS. My husband told me that I don't have strength to push our baby. We only have one. I'm scared to death to go through it again.
Okay, for such woman, you have, I will call it, you have the higher hand there. Now, if there's no indication for you to do a cesarean section and you want to, she says she's afraid of cesarean section. That's it.
Yes.
That question?
No, her husband. Okay, she said she won't go through cesarean section, but her husband they tell her say she not get strength to push the baby.
If it's her request, so at this point, this is where the couple come together and they have to now decide. And usually the woman's decision usually supersedes. If she wants a cesarean section and she doesn't want to go through a normal vaginal delivery, which it falls under relative indication, then she can go on. But
doctor, why is this that so many people think say now by strength, even when the woman clearly they go through some medical issues and they see them clearly, but they still insist say na strength. Some insist say okay, you dey lazy, you know, go fit push the baby. It's no more annoying.
Yeah, it's very annoying because most times the men, they are not the ones that are carrying the baby. They are not the ones that are having all these symptoms. That they are not the ones that have the pressure symptoms and carrying the baby up and down. That's why. So sometimes it's all about the education of the couple. That's why antenatal is very important. In fact, sometimes we ask the men to come along, to come and listen and understand about these things. You see people who attend the antenatal very, very. They have husband antenatal clinics and itself where they come with their wives. Most times before delivery, they get to understand. So it's about education.
All right, someone said all the way from Germany. She say, oh, my own was they weren't feeling my baby heartbeat and they had to quickly do a cesarean section. She say African women should wake up. Thank you, doctor, for emphasizing on the cervix of the African woman compared to the Hebrew women.
Yeah, thank you very much. Next one.
Okay, somebody say, oh, I love you, doctor. Please, can I send a DM? Yes, you go mention in handle before you go, so you go send all the DM where you want. Okay, get your DM ready. Yeah. Somebody say, good afternoon, church. A great topic you guys have. Always a vibe. When I saw the poster, I was excited. CS is forbidden in my church. Can you imagine, doctor? What should I do?
CS is forbidden in the church building. Do you understand? CS is forbidden in the church building, not in your home. Now, when they say CS is forbidden in your church, those usually most times when I always love to interact with pastors because I think most times they go home better informed. I wish many doctors are like me. I'm sure my colleagues they know me that I don't take nonsense. First of all, I come and put some scenario before them and ask them, see if it's your wife, if it's your daughter that needs cesarean section and needs surgery, to say if it was not a baby and she needs surgery, you say no itself. So these are questions she pose. So what she can do if cesarean section is indicated, no pastor has the right to say no. Any pastor, in fact, there should be laws of punitive measures and punishments. I've always advocated for that. For any pastor who is trying to increase maternal mortality. Yeah.
All right. Someone says, thank God for my bishop. He always advised her to go for the CS that is not even an abomination. And they should not mention the name of her own church. All right. Another person from the UK said, Nigeria should wake up. CS is not a sin. Have your children. There are so many medical reasons why these things happen. Thank you, Dr. Ose. I'm a fan of you now. Okay. There you have it. And another person said, I'm a first-time mom, and they told me that I have some issues I can't talk about here now, but it means I will have a CS. Cheche, I've been having BP because I've been having constant issue at home with my husband concerning the CS. First, he says the money is too much. That can't I just go and have birth like my mate? Cheche, I'm disturbed.
Yeah, she should not be disturbed. She should not be disturbed. First of all, if they're giving an indication for primary CS, therefore means it's most likely an absolute indication Probably she's having a complete placenta previa, maybe the placenta covering the whole cervix. Or she's having maybe a contracted pelvis. A contracted pelvis is a pelvis that the baby will never come down out, even if Angel Gabriel comes down to take that delivery.
All right.
The baby will not come out itself. So she should not worry. She should, if her husband is, I wish her husband can be here. He has to look for how to do the cesarean section financially, and she should not give her baby problems.
All right. Thank you, doctor. We get a few minutes to pick calls. Hello, Lagos.
Yeah, Yemi, my lover.
Original lover, welcome on top of the show.
Thank you for bringing doctor on board.
You're welcome.
Doctor, good afternoon. Huh?
Yeah, good afternoon.
Yeah, doctor, my question is this. You see, these days, I don't know, maybe it's because people have the money, but you see most women today, after seeing their gynecologist, and they tell them they're going to deliver normally, but they still prefer to go through CS. And that is a challenge for me. I don't know why it's like that.
All right. You hear what he talks? Say most women prefer to go through CS these days. I don't understand why. You think?
Okay. I wouldn't say they prefer now. Now I understand what you are saying now, because a lot of women, they don't want to go through the rigor of latent phase labor and prolonged labor. Sometimes 8 hours, 10 hours. They just want 1 hour their baby's out, and that's their maternal request.
Okay.
Now, ideally, we are actually trying to reduce the cesarean section rates worldwide. But a lot of women who have weighed the risk. Now, there are some women who genuinely need the cesarean section, and there are some women who want this. Now, because of how everyone is informed and looking at it, and we also tell them it's actually still 50-50.
Okay.
You can have mortality, but very reduced from cesarean section. That's woman dying on the table. It happened, but it's not. But so women are getting more exposed, and they are now knowing that there are alternative routes to vaginal deliveries when as needed. So it's not a bad thing. It's not a bad thing, actually. For me, it's a route whereby baby comes out. Can that come out vaginally or abdominally? So this practice, or as you call it itself, is not just sacrosanct. I would call it bad. It's because they are exposed now, and people now see that they can get through these options.
Last question, doctor. Time don't go. Hello, Lagos. Drop your question. Hello, drop that question so doctor will answer. We get less than 3 minutes. Hello.
Hello, Chacha Smith.
Hi, Boo Boo. Good afternoon.
Is Mrs. Bello? Yeah, doctor, sir. Well done, sir. Yeah.
Yeah, thank you.
Yeah, my question is based on what your lover just asked. I have a sister who they have told that she's going to give birth through the cesarean system method. Why then in the hospital? And she just see women just giving birth, carrying their baby, giving birth, carrying their baby. She just told herself that I can do this. Before you know, she's made up her mind to push, and that was how she had the baby. Why every other thing they wanted to use for the operation was ready. So, doctor, how do you balance this situation?
All right, you hear what she talk?
Yeah, I heard, but let me answer quickly. Now, there are many things that would have played out. I've seen that a lot. Now, sometimes when you have what they call failure to progress in a labor, where the woman has a constant dilatation of the cervix, and you now think that, this is maybe an abnormal presentation. I would just mention this is a medical term, maybe an occipito posterior position.
Oh God.
Sometimes during the part of the delivery, the baby can just change, and immediately there's a slight change, the baby comes out, and if the baby cramps and it comes out, that's why sometimes you hear we are praying for cesarean section,
and the woman pops.
The baby comes out vaginally. So that's what usually happens. So it's not the doctor's fault. The doctor wanted. It's called the expedient route of delivery. You must take that on the expedient route of delivery, either vaginal or cesarean section. So that's what usually happens.
All right, doctor, wrap up now in less than 2 minutes, please. And also let the people know where they're going to reach out to you, the best way to follow you and all that.
Okay, I know DM's going to, they can Magnum ads, you can Magnum ads on Instagram. Just on Instagram. You can contact me there.
Please spell that your handle. Spell that handle.
Magnum, 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 ARTS.
Okay.
Magnum ads.
All right.
Yeah.
All right. Yeah. Thank you so much for your time, Dr. Ose. I hope I know they bother you too much, but I get to drag you out to always come to explain. We still get more topics to talk about, but let's see. Thank you.
Very much.
Nobody gets to ask you how are you. Doctor say how are you?
I did.
I don't know. Thank you. Always a pleasure here. Always a pleasure. Lagos, you go if you catch the recap of this segment on YouTube, on Facebook, find us Wazobia FM. We did there for you. Always they do the best for you. On Top Health Corner, we're gonna look into so many of these issues, and you go feel also the learn. My name is still Cheche Smith. Dr. Ose did there. Go make you ask some other question where you know if you answer at Magnum Art. And also if you don't know the handle, go on Top Wazobia FM Lagos, on Top Cheche Smith Nation. You go see them because we mention them for there. And we take a break, but we're going to talk to our friends and sponsors once we come back. Even the information minister is on board, and I think we can do something. Naba. But make we take a break. We'll come back, then you do something. Lagos, I they come back to you on 1, 2, 3, 4. We'll take that break.